so let's tell the jury about your examination.
So I noticed she's a pleasant female. I said she's accompanied by her attorney, who did not in any way obstruct in her interview, so I didn't get in the way of anything in that context. She had her walking boot on. I asked her to ambulate. She's able to do that. She says actually she does better when she's barefoot than in the boot, but if she wears the boot when she's out of the house. I noted that we call it an antalgic gait, so a gait that was somewhat asymmetric that seemed to be pain-related. And there was limitation in the motion of the ankle, so we talked about that's, I think, something you would expect in somebody who's now worn a boot for over 3 years, that their ankle's not going to work right that way. There was a little bit of tremor when we moved the ankle that way.
And I say a little bit of tremor.
Again, I think that's just related to being in the boot a long part of the time. So the motor functions is going to be normal. Affecting that, even if you're coming in and out of the boot, if you're wearing it any length of time during the day, I would expect to see, be able to see something like that. I think then we went on to the different sensory testing I was talking to you about. So the cotton, we're now 3 years out. You would think in the CRPS case, if it was established that way, in my opinion, you would have that, we call it allodynia. So she, I put it in quotations to describe it as a scratching sensation. So I don't know, she didn't sort of expound on that. It didn't seem real uncomfortable with touching. Some patients with CRPS who we touch.
Tell the jury whether this cotton ball test, what you're doing.
But just using a light cotton or a gauze, either way, I may sometimes use a cotton pad, exactly that, or a gauze, which maybe gauze is a little more scratching than the normal person. I don't think of it too much that way. But it's, I think, again, she described the scratching sensation, which isn't a typical term at all, but I hear with CRPS for sure. And then I think more important to me, one of the things on my exam, the toes were spared, which I don't know that I've ever seen that with CRPS. It is known to be a disease of the distal part of the extremities. So I certainly would have expected to see the toes involved, if the foot's going to be involved, but it's just a classic part of CRPS.
So let me tell you, it's not different. Toes are spared. What do you mean by that? How did you determine that?
Well, so I mean that was normal sensation in the left hand right toe, so it didn't have even the scratching sensation. So the way the nerves kind of line up in the body and the way CRPS works, that's not something I've seen in patients with this condition. So that was important to me that way.
So when you say CRPS is a disease of the distal extremity, the jury of that doctor, distal means farthest point away. Is that right?
Exactly.
Okay, so that would be the tip of the most distal part of your foot.
Right.
Okay.
So, and then I tested her with cold with an alcohol pad, and again, she noted that somewhat as painful. I don't think it was, wasn't really one of the classic out of control sort of allodynias that we see, but she did give the report of it being painful. Again, though, the toes were spared on both sides with the cold. The vibration, so that's a tuning fork, is how I test that. I don't know if you've ever seen the tuning fork. It sometimes says that it also has sort of a vibration sense if you've ever put it up against you. So that one did elicit pain in the midfoot and in the calf. And she said it was different than the cold, so she described it like lightning bolts, which I think is something she's used in other descriptors for her, this pain, this sort of lightning bolt pain. It's unusual to see it just with one type of sensation, and particularly of all of them vibration, but I think, again, at this point, just doing the exam, I'd like to do the exam and then later kind of make some interpretations about it. But that was part of the exam. And the last two or three things, pinprick described, it really wasn't hyperalgesic. She didn't have an abnormal pain response. She did describe scratchiness to that, but there was no hyperalgesia to pinprick at all that way. And then the temperatures were recorded, and there were differences. The left lower extremity was warmer. not everybody, but the majority of CRPS patients, again, 3 years out, particularly who haven't had any other treatment other than what the little bit she had at that point, would be cold. You would think that certainly gave the time to equilibrate, but it was warmer. In one area that it wasn't, with 4 out of the 5 measurements. And it varied, sometimes as little as less than a degree difference, and then sometimes the greatest difference was 3 degrees difference. And then the last one was the circumference of the cap. The right was a little bit smaller than the left, so the left was 1.5 centimeters in circumference, so it would be about 3%, 4% smaller, larger on the left, the affected side, so 30.5 centimeters, 2.5 centimeters or an inch, so she was 1.5 centimeters different in the all-around circumference on the left